Parents, I appreciate your taking the time from your busy schedules today to come in and talk with me about your child's upcoming orthodontic treatment. Whether this is something new for your family or not, I still think it's a good idea to take a few minutes before the treatment begins for us to share some ideas about what's coming up for your child's treatment. You have a big investment in both time and money coming ahead in the next couple of years. And so I think it's good for us to get a good, clear understanding about what's in store for us before we begin. This conference today, I have it divided into two parts. First, the video that you're watching right now, and second, a personal visit with me in a few minutes. On the video, I want to go over with you a few things about how your child's treatment will proceed, about what the different appointments that will be required will involve. Then I want to go over some of the risks that are involved with orthodontic treatment for you and your child. And then lastly, on the video, we'll talk about some of the office policies that we have in regard to our braces patients. Then I'll come in and personally go over with you some specifics about your child's individual case, some of the problems that we see with your child's teeth, and what we plan to do about solving those problems for him. First of all, we have 4 appointments that are needed to get the braces done for your child. The first appointment is the records visit. We've already done that for your child, where we took models of the child's teeth, some x-rays, photographs, and pictures. We'll have those to show you today. The second visit, the conference, is here so that we can explain what's in store for us. The third visit, we'll need to do some separators for your child's teeth. That's some little blue rubber bands that we fit in between their molars so that we get some space to fit the orthodontic bands on. The separators can be put in today on some occasions, and other times we'll schedule a separate appointment for that. The separators will move the teeth apart just enough for us to get the braces on. The child will be sore with those for 2 or 3 days as the teeth begin to move. The fourth visit is the long appointment when we actually put the child's braces on. We need about 2 hours for most complete braces patients to get the braces on. In the back, we'll put bands around each individual tooth so that they can withstand the chewing forces better than brackets can. But brackets are put on the individual teeth in the front of the mouth. Brackets are glued onto the front surface of each tooth. There's a separate bracket made for each tooth. The brackets will be glued in place on the 2-hour visit. Then a wire will be put through the slots in the braces. A tiny little rubber band is used to hold the wire into the slot on each brace. And it's actually the wire that does the work of the braces to move the teeth. We begin with just some very thin wires, some very flexible wires that can be distorted into crooked teeth. And then each time we do an adjustment, we'll add a little bit thicker wire to the braces to get the movement that we need. Each 5 weeks we'll see your child for an adjustment, approximately each 5 weeks. And then the first half of that treatment, about 10 months of these adjustments, will be concerned with our first objective of treatment, which is getting the teeth straight, making your child's mouth cosmetically pleasing and having a nice smile. Each of those visits will be concerned with getting crowding taken care of, with closing spaces that need to be closed, and improving the appearance of the child's teeth. At the end of that first 10 months of adjustments, we will have an upper arch, upper teeth that are nice and straight, a lower arch that's nice and straight, but many times the upper and lower teeth are not fitting together as well as we'd like to see. So the second half of the treatment, the second 10 months of adjustment or thereabouts, is concerned with the second objective, which is getting the child's bite corrected. That means we want this straight upper arch and straight lower arch to fit together as well as possible so that your child will have a comfortable and efficient bite. So we spend the second half of the treatment concerned with getting the bite corrected. Each of these adjustment visits will change a wire or will add an attachment to the braces to get a various movement that we might need to get accomplished that particular month. At the end of 20 months, and that's a very approximate figure on some children whose teeth just respond a little bit better or who've had some preliminary work done, it may be less than 20 months for a complete case of braces. Other cases, treatment may be slower for one reason or another, and it may be 24 months or more. But however long it takes for us to get the most satisfactory result that we think we can accomplish for that particular case, we will remove the braces in another long appointment. We will take about an hour and a half to take the braces off. The teeth will need to be cleaned up, all the adhesive removed from the teeth. Another set of records made, the molds and x-rays and photographs will be retaken so we have a before and after picture of your child's treatment. And also retainer impressions will be made that day. When we take the braces off, we're concerned that we want to keep the teeth in the position that they're in. And to do that, we need to use retainers after the braces are gone. On the lower arch, we usually use a cemented-in wire behind the lower front teeth that will stay for several years to keep those teeth from moving. The upper arch, we use a clear plastic retainer, removable type, that the child will just sleep in for a couple of years. The retainers will be included in the fee that you've paid for the braces. I want to go over now with you some of the risks that are involved in braces. I have for you some sheets, 3 sheets that you have in front of you that we'll need for you to sign so we can keep them in the child's chart. We'll give you copies to take home with you. I'd like to go over those sheets with you now, one at a time. The first sheet says, "We want you to know" at the top. This is some of the risks that are involved with braces. Most of these risks that we take are things that could go wrong with your child's teeth whether or not they were in braces. But since the child is under treatment, it'll be difficult to tell sometimes whether the braces caused these problems or not. And so for this reason, I want you to be well aware of what some of these potential risks are, even though they're rare and even though when they do occur, they're not that serious. The benefits in most cases of treating the child far outweigh the risks. We still want you to be aware of these things. Let's begin with number 1, patient cooperation. We're going to depend on your child a great deal to accomplish a portion of the treatment. There's just so much that we can do in the office, and nothing that we do here can overcome what your child won't do when they're away from the office. Probably the most important thing in terms of cooperation will be your child's compliance with things that we ask them to do, like wearing their retainers at the end of treatment, wearing rubber bands from the top braces to the bottom ones to get their bite corrected, taking good care of their braces, not abusing them so that the braces don't get broken or distorted during treatment. Very important that they brush their teeth well during treatment. Keeping their regular monthly appointments is also very important. And these factors that your child is in control of will make a great deal of difference in how successful our treatment will be, and also in how quickly we end the treatment. The second factor is decalcification. Here's a picture of what decalcification looks like on teeth. It's a discoloration of the enamel of the teeth that we notice when we take the braces off. It's normally a result of your child's not keeping the braces clean. Under the wire and around the braces, plaque and food can accumulate. It's difficult to brush it away, but it's very important that your child spend the time to do it. If it doesn't happen and the food and the plaque accumulates for weeks at a time, like it sometimes does, the enamel can weaken and it turns chalky or white, like you can see here on this photograph. These marks will not go away, so it's important that we practice excellent oral hygiene while the child is in braces to prevent decalcification spots. While your child's in treatment, by the way, I wanted to mention that they will need to get their teeth cleaned every 6 months on a regular basis, even while the braces are on. The third factor is non-vital teeth. This means that the nerve inside the tooth can sometimes die. That's not usually the result of the orthodontic treatment, but usually a result of an injury to the tooth or a blow. This can be corrected by a root canal on the tooth, and it's a very unusual circumstance for this to occur while a child's in braces. Neck strap or headgear retraction. This is some treatment that we use occasionally to bring back upper teeth that are protruding too much. Your child may or may not even need headgear treatment, but if they do, particular instructions about the safety of wearing headgear will be important to follow to prevent injury to your child. Root resorption is a risk that's involved with the shortening of the ends of the roots. When we move teeth through the bone, particularly upper and lower front teeth, there is a risk that the length of the root can shorten some during treatment. It almost always happens when we move teeth, but it's most frequently imperceptible. You can't even tell by looking at the x-ray that the root has shortened. Yet in a few isolated cases, very unusual, the roots resorb significantly, and there's a third of the root perhaps lost during orthodontic treatment. Most people wouldn't even know that that had occurred to them if it wasn't obvious on the x-ray to the dentist. Since this is an unusual situation, it's not of a great concern in most cases, but where the significant root resorption occurs, the life of the tooth may be shortened somewhat if the patient were to receive a blow to that shortened root, or in the advanced years if they were to have periodontal disease or pyorrhea, the length of the life of that tooth could be shortened if the roots did resorb significantly.